Hello, I'm Dr. Michael Kriegel. I'm a pain psychologist that has been fortunate enough to work in a variety of roles, primarily though in interdisciplinary pain management since the early 1980s. And I appreciate the chance to provide this interesting course, and hopefully you'll find it valuable.
What is interdisciplinary pain management?
In order to understand interdisciplinary pain management, it's essential to start with an understanding of what pain is. And obviously, all of us experience pain in various ways. It's commonly something we experience to some level almost every day. And so, we all have that experience of discomfort. But what's key is to realize that there are various types of pain and pain disorders, and one that is most important to be aware of is what's referred to as complex chronic pain. To understand pain, and especially complex chronic pain, is the model that is currently being used is called the biopsychosocial model of pain. That incorporates the physical aspects of pain, the psychological aspects of pain, and the social aspects of pain. So consequently, you have to look at physical things that may be involved with discomfort. It may be an injury, it may be an illness, it may be surgery, a variety of things that can happen, and what that pain source is. Psychologically, it's important to realize that pain is also a part of our psychological experience. Loss of a loved one, loss of a job, things that may be depressing can all result in the sensation of discomfort. And the same thing with the environmental aspects of our circumstances can play a big role, loss of a job, or sometimes it's even where we're experiencing trauma. Those all can play a part in the experience of discomfort. But what's key here is that those are not isolated. They are all connected, so that if someone has, for instance, is involved in an accident and they experience the loss of a loved one and they now are unable to work, that can create an interactive process within those three areas that becomes increasingly difficult to manage and control. And so consequently, the traditional medical approach, which we'll discuss a little more later, struggles to address that biopsychosocial model in a consistent and effective way that's powerful enough to turn it around for some patients. So interdisciplinary pain management is the only field of healthcare that was specifically created and developed to treat pain with the least amount of opioids possible. And it focuses on being able to address all three aspects of the biopsychosocial model simultaneously. And that is not a common thing in medicine. Medicine generally assumes that time has a beneficial impact, and that is absolutely correct in a lot of cases. The vast majority of injuries, illnesses, diseases that we experience, time can be helpful. That if you take this medicine or you have this treatment and give it a little time, your body's ability to repair itself and eliminate the discomfort is almost is the most common aspect of what we experience. But in certain situations, the complexity and the type of discomfort that people experience requires a much greater intensity of treatment. And that care is where we try to eliminate the time in between the treatment, therapies, modalities, and medications in a way that is able to address this biopsychosocial model in a much more powerful way. And so that is what interdisciplinary pain management is founded on, is the concept that we can help this patient much more effectively if we do it in a very intense manner that minimizes or eliminates as much of the time in between the treatments as possible.
What is the history of interdisciplinary pain management?
The history of interdisciplinary pain management is quite interesting, and I was fortunate enough to be part of that in the early beginning. Interdisciplinary pain management was created by a number of folks in the early mid to late 70s But in the early 1980s is when I joined, and we were able to develop a lot of the treatment techniques that became the cornerstone of interdisciplinary pain management throughout the 80s and 90s. The key thing to realize is that back at that time, there were relatively little available treatments. The medications were primarily meperidine and morphine, and it made it very difficult to treat patients in an effective way, especially post-surgical patients. So we developed treatment approaches that incorporated the variety of medications, modalities, therapies, and in particular, a lot of the psychological characteristics that were available at the time and being developed, and especially cognitive behavioral therapy became one of the more important aspects of the treatment approach. The development of the field became quite popular. It was very, very powerful. There were very few treatments available at the time. It was a bit of an exhilarating time to be able to be on the forefront of a lot of the developments across the country. And I was fortunate enough to be able to initially implement and develop 11 large hospital-based pain centers, and then went on to do another 11 on top of that that were more often outpatient facilities. In the late 1990s, the insurance companies and the drug companies, unfortunately, developed a relationship and actually colluded to put interdisciplinary pain management out of business. It was very much of a coordinated effort, and it was very effective. At one point, there were 3,000 or so interdisciplinary pain centers throughout the country, and by the end of about 2003, there were maybe 40. And so they eliminated our reimbursement style, and that put us out of business. Fortunately, in 2017, there were 37 state attorney generals that sent a letter to the insurance industry accurately accusing them of colluding with the drug companies to be part of the opioid crisis. And so that allowed me to begin using some of the same logic to reestablish interdisciplinary pain management that we did way back in the very beginning in the 1980s. So we are in the process of revitalizing interdisciplinary pain management. And if you're watching this, I hope that you have a real interest in being part of that resurgence, and that we're in the process of bringing something back to the country that is very much needed, and hopefully will not only impact the way chronic pain is treated in the country, but will also have an impact on the opioid crisis.
How does interdisciplinary pain management differ from traditional pain management?
The difference between interdisciplinary pain management and traditional medical care is significant. There are many aspects of traditional medical care that are very effective and are certainly appropriate for the vast majority of pain disorders. However, certain chronic pain conditions require a much more intensive approach, and that means to eliminate a lot of the time difference between treatments. So while the traditional medical care may involve a medication or a treatment or some sort of modality, the aspect of the traditional care is that time is a beneficial factor. That if you provide that treatment and then give the patient's body ability to heal or repair itself over a certain amount of time, that will be all that's needed to help repair or restore the patient to full function, and therefore restore or reduce their pain. The key part of this is that interdisciplinary pain management, on the other hand, is approaching the treatment from the standpoint that pain is now debilitating or interfering and increasing based on the fact that it is longer and longer in the person's experience. So minimizing the time between treatments or modalities, medications, or therapies is one of the more powerful aspects of the treatment approach for interdisciplinary pain management. So instead of somebody receiving physical therapy, for instance, 3 times a week for an hour. Interdisciplinary pain management would provide physical therapy every day for an hour and a half or 2 hours. It would include medications. It would include psychotherapy. It would include a variety of other modalities and treatments from occupational therapy or from nursing. And so this would be provided in many cases in a day-long treatment approach that would be very intensive from one treatment to the next. That's very different than what you see in traditional medicine because it assumes that time, in many cases with chronic pain, is of a detrimental factor, not an enhancement of the treatment itself.
What types of treatments are included in interdisciplinary pain management?
That's one of the more important aspects of interdisciplinary pain management. And it's a direct reflection of the interaction between the biopsychosocial aspects of chronic pain. It's essential to realize that if we're going to be able to address someone's discomfort in an effective way, then we have to first do a thorough assessment on that or of that patient to determine how much of each of those factors are going to be playing a part in this particular patient's care. So, for instance, is the patient clinically depressed? Is the patient experiencing weight gain, or is there other health issues that are involved, like diabetes or blood pressure issues? Most patients with complex chronic pain have difficulty sleeping. They have difficulty being active. That it's common for activity to cause an increased discomfort. What level of medication do they have at this point? Are they taking a lot of opioids, for instance? What other medications could be, utilized with this particular patient? So what we have to do is make a very individual clinical approach and then utilize the treatments that are going to be best for that patient. It's important for us to be able to target the specific symptoms that this patient is experiencing in a way that allows us to reduce that interactive. And a way to think about it is that the process of the chronic pain development is more of a spiral than a straight line. It's based on the interactive processes that occur where the pain causes someone to have difficulty sleeping, and the sleep deprivation causes the patient to get more depressed, which causes the patient then to be more tense, which causes the patient to have tighter muscles, which causes an increase in pain, which causes a more difficulty sleeping, which causes them to be more depressed, which causes them to have insomnia, which causes them to have more trouble sleeping, which increases their pain. And so the interactive nature of complex chronic pain is one that has to be addressed with a variety of modalities. And so therefore, the most common staffing for an interdisciplinary program are medicine, psychology, physical therapy, occupational therapy, and nursing. But that doesn't mean that we can't use a variety of other modalities. Acupuncture is common. Massage is common. PT modalities are very, very common. Biofeedback and other things that can be used to address people's discomfort. But the key part of it is that it has to be provided within the context of the overall treatment program and not just a standalone treatment. As I mentioned earlier, it's the intensity that is so important in the provision of treatment for these patients with their complexity and their discomfort.
Who can benefit from interdisciplinary pain management?
The range of clinical procedures and processes that are engaged with surgery makes interdisciplinary pain management an excellent treatment modality to be involved with some of the more difficult surgical procedures. In addition, the types of injuries that can occur are also potential treatment aspects for interdisciplinary pain management. More chronic conditions like arthritis, complex regional pain syndrome, rheumatoid arthritis, as well as even sickle cell discomfort, are all conditions that are very well treated by interdisciplinary pain management. The components that interdisciplinary pain management bring to bear with these various conditions are effective because each patient is treated very individually. So, for instance, a patient that may have some form of spine disorder that needs some type of surgery, say a laminectomy or a discectomy, or even especially if it's a fusion, is going to have a long, difficult recovery if they are not in the condition to be able to respond to that surgical intrusion. It's important to realize that if somebody's overweight, out of shape, depressed, frustrated, if they've been out of work and then they have surgery, that isn't necessarily going to make a big difference in their discomfort or their functionality just because they had surgery. It actually is detrimental in many cases because now the patient, for instance, if it's a fusion, now the patient has to be immobilized for some period of time. Oftentimes it's for months. They get even more frustrated. They get even more depressed. They get even more deconditioned. So what makes a big difference in that situation is to be able to use the interdisciplinary approach to treat patients before surgery, if possible, and certainly in the post-surgical manner, and to have that to be seen as a part of the overall treatment plan, that the treatment is, not only interdisciplinary from the standpoint of the modalities and the disciplines I mentioned earlier, but it incorporates the surgeon in the treatment of the patient. And so it makes much more of an opportunity for a patient to recover quicker and more effectively. And for instance, in the treatment of someone with, a chronic condition like chronic headaches, headaches can be incredibly debilitating. It is very, very difficult for some people to manage their headaches, especially if it's a migraine or a combination type of headache pain. They affect their entire lives. It interferes with their work. It interferes with their family. It interferes with their sleep. And more importantly, it causes them to become quite anxious and scared about the potential to have another headache that they are not able to manage. That type of patient is treated most effectively in an interdisciplinary manner by utilizing a combination of biofeedback, physical therapy, medications. Especially the cognitive behavioral therapies are very effective in that situation, and it gives us a chance to address the whole person in a way that gives them tools and options to address the discomfort in a way that gives them control of their pain instead of their pain controlling them. Other chronic conditions are also effectively treated with interdisciplinary pain management. And I think that you can see that as the patients are referred, we have a wide range of diagnoses and medical conditions that the treatment team is capable of assisting in managing their discomfort. Again, I want to emphasize something I mentioned a minute ago, and that is the approach is to address the patient's discomfort and dysfunction in a way that allows them to control their pain instead of their pain controlling them. We do not promise that we're going to help this patient eliminate their pain. We hope it will be controlled. We hope it may even go away. But the goal, instead of controlling or eliminating the pain, is to give the patient the tools and the approaches, the treatments, the modalities that allow them to control their pain, and more important, help them regain a productive and enjoyable lifestyle.
What role do medications play in interdisciplinary pain management?
This question is one of the most common questions that we respond to, and it's obviously a very important question. So what's the key thing to understand is that medications overall play a very important role in interdisciplinary pain management. They are also part of often what is the problem in managing this patient's condition and managing their discomfort. So I want to separate the medication question into two. One is opioids, and the other is pretty much everything else. So let me talk first about opioids. Interdisciplinary pain management does use opioids in the overall treatment plan, but the original purpose was to create and develop a field that was going to focus on using the least amount of opioids possible. So our goal is to minimize opioids. And the reason is because, as blunt and frank as I can get, opioids don't work. And that is one of the more important aspects to understand when looking at any kind of chronic discomfort, is that chronic pain is exactly that. It's chronic. Opioids, on the other hand, do not have the capability to maintain the same level of pain relief over time. And that is where a lot of the opioid crisis came from. The mistaken idea that was proposed in the late 1990s that opioids were not addictive and that they were effective in the treatment of pain, especially chronic pain, was completely wrong. If you have had any awareness of the lawsuits against the drug companies and the pharmacies and the drug distributors, that is absolute proof that the American public was lied to very directly by the opioid manufacturers. And it was the cornerstone of the start of the opioid crisis, which goes on today and is still killing thousands of people in our country all the time. So opioids do have a role in interdisciplinary pain management, but it is a limited role based on the scientific facts that say opioids are not a long-term treatment approach. And so our goal is always to get patients on the least amount of opioids possible. Here is another example of why opioids are such an issue. There is a condition called hyperalgesia, and it is extremely important to realize that this condition is one in which the neurotransmitters in the body react to the opioid chemicals in a way that actually cause those neurotransmitters to respond more actively. So what that means is that in the long-term use of opioids, such as like OxyContin, then what will happen is that the body will become more responsive to pain signals of all kinds. So hyperalgesia is where the pain response is actually accentuated by the opioids themselves. The only way to treat hyperalgesia is to take less and less and then eventually none of the opioids and be off of the opioids for 2 to 3 months. So it's essential that people find ways to manage their discomfort with the least amount of opioids possible. The other medications that are used include a wide variety of medications that can be very helpful in minimizing the discomfort someone feels, but also in giving them a way to control their pain that works every time at the same amount. And there's a variety of medications like gabapentin. There's a variety of muscle relaxers. So there's all kinds of creams and different non-steroidal anti-inflammatories that are commonly used. But it's important to realize that all of them have limited ability to eliminate the pain, but they have some ability to assist with managing the pain. And one of the more interesting aspects of our treatment that I was able to participate in back in the 1980s was we did research on over-the-counter medications. And we found that 800 milligrams of ibuprofen taken at the same time as 1,000 milligrams of acetaminophen had the same pain relieving effect as 30 milligrams of codeine. And that's really an important aspect to realize, that it doesn't take a prescription. It's not addictive. There's very few, if any, side effects. and it can give solid pain relief for a variety of pain conditions in a very short period of time, and it will generally last for 4 to 5 hours. That medication regimen can be taken 3 times a day, and it can be taken over a long period of time if necessary, as long as there's not any stomach distress. And it allows you to then be able to manage that pain or discomfort without the hyperanalgesia danger that opioids present. So if you take a look at the different things that we use in interdisciplinary pain management, the first question that we ask is this treatment modality or medication going to cause more problems in the long run for this patient than what they have right now? And that's why the issue of medications is such an important one in the use of interdisciplinary pain management to help patients with complex chronic pain.
What is the benefit patients receive from IPM?
Patients that are able to receive interdisciplinary pain management treatment are going to find that they are able to address very quickly a lot of the different aspects of their pain. That doesn't mean that they will be able to eliminate that pain immediately, but it means they will be able to have impact on it. One of the more important concepts within interdisciplinary pain management is to realize that for the vast majority of these patients, the biggest issue is the lack of control. The fact that they are often tied to a prescription of opioids or, dependent on some form of avoidance of the pain. As I've mentioned, the opioid issue is a big one. And opioids don't fix anything. They just literally change the physical pain response. So people don't feel the pain. That doesn't mean the pain's gone. And so consequently, there's an enormous insecurity about the patient's ability to control their discomfort and therefore control their lives and lifestyle. So one of the things that happens in the interdisciplinary pain management treatment is that the patient is given the opportunity to provide a variety of treatments to themselves and be able to then gain the confidence that they're in control. They're the ones that are able to manage their pain. They're not dependent upon going to see that doctor every month, and they're not dependent upon making sure they get that prescription every month. They're able to know themselves how to approach this discomfort in a productive and effective way. So one of the more important aspects of interdisciplinary pain management is to give the patient back the confidence that they may have had before this whole issue with their discomfort occurred, and give them the chance to be able to have the ability to live their life with the relief, not only physically, but also the relief from that anxiety that their lives are being controlled by pain.
Can interdisciplinary pain management help with post-surgical pain?
As I mentioned earlier, it absolutely can help with post-surgical pain. Interdisciplinary pain management is a treatment approach that allows the post-surgical patient to address all the different aspects of the discomfort and the dysfunction they may have from the surgery. But as I mentioned, it also can be provided in what we refer to as prehab, where the patient is given the opportunity to get stronger, healthier, on less medications, have ideas about how to manage their discomfort better, and also to help them understand what the surgery is going to do. What is the aspect of this surgical approach that's going to make a difference in their discomfort and in their condition? Post-surgery, there's got to be a way to help people get back to functioning. If we're going to be able to help someone, for instance, with a knee replacement, then the number one thing that they have to be able to do is recover from the surgery itself and be able to walk and move and function in a way that is going to be normal and healthy for them. It's common with post-knee replacements for people to be anxious. Well, that's where the cognitive behavioral aspects of the program comes in. They're going to have a lot of weakness in and around that knee. That's where the physical therapy comes in. And they're going to have a lot of concern and difficulty with normal modalities and, activities of daily living. That's where the occupational therapy comes in. So it all gives us an opportunity to put together a treatment plan that allows the patient to receive what they need to recover as quickly as possible. And that's the other aspect that I think is such an important point for post-surgical patients, is that after a surgery, it's common for there to be some form of difficulty, challenge, pain that lingers, that is there for a while. And what interdisciplinary pain management provides is a much quicker, safer, more effective recovery from a surgical process that may have been very needed and may help a lot. But it's important that we not just look at the surgery itself as the fix. We have to get the patient back functioning and living their life again.
What is the application process to get into an IPM program?
The process for applying to an interdisciplinary pain program is different than in many medical applications and medical treatments. The referral to an interdisciplinary pain program is required. It has to come from a physician, and it has to include all of the medical records that we can possibly make available. The reason for that is because the vast majority of patients that are referred to interdisciplinary pain programs have been in pain, taken a lot of medications, had a wide variety of procedures, and it's gone on often for months or years. And so consequently, we have to have a very thorough evaluation process that allows us to determine if this patient is one that we can really help. The key part of it is that the patients usually have not just managed their situation, they have deteriorated. And so that's where, over a period of months or years, it's important that we get all the different information possible to be able to give the best opportunity to evaluate this patient and be able to put together the most effective treatment plan. The key part of this as well is that there are certain types of conditions that aren't going to be effectively treated within an interdisciplinary pain management program. So consequently, there are certain exclusion criteria as well as inclusion criteria. The inclusion criteria are that the patient should have been in pain and struggling with their situation for 6 months. That makes it chronic. The patient should have a motivation to get better. They want to get well. The patient needs to have some understanding of what their condition is, and we would have to approach the situation in a way that gives them insight into how the treatment plan is going to help them. The exclusion criteria are such that if someone has a primary addiction problem, then that needs to be dealt with first. It's not uncommon for people that have addiction to also have chronic pain, but that's not our primary approach. We certainly do work with people that are taking lots of opioids, and we certainly do help detox them throughout the treatment program. But again, if the primary issue appears to be addiction, that needs to be dealt with first. The second thing is if somebody has a primary psychological issue, if they have a psychiatric problem that is one that is debilitating or is the primary issue that they are dealing with at that time, then again, that needs to be dealt with primarily with the psychological treatments that could be done within a psychiatric hospital or psychiatric care. If someone is not motivated, then therefore we would not be willing to incorporate them into the program itself. So those are the kind of inclusion, exclusion criteria that we use to ensure that patients that are evaluated that have the opportunity to get the best assessment process or possible. When we do evaluate a patient, it includes a thorough evaluation of all of their medical records. It includes an assessment by the physician, an assessment by the psychologist, the physical therapist, the occupational therapist, and nursing. It is a very thorough evaluation. Afterwards, the team meets, and this is another big difference between traditional medical care and what happens with interdisciplinary pain management. And it also helps to include the patient in the discussion. So we would meet as a team, discuss what the findings are from each of the different disciplines, and then put together the determination if it is something we feel like we can offer the patient that would be helpful and get their pain under control. And if not, then we would say so to the patient and help them understand that this is not the right treatment for them, that there may be other treatments more effective for them. But if it is the situation where the team believes that there's a real opportunity for us to help that particular patient, then what we would do is offer them admission to the program and create a specific treatment team that would focus on the goals and the needs that this patient has at the time.
How is a treatment plan developed in interdisciplinary pain management?
The treatment plan in interdisciplinary pain management, as I mentioned a couple times, is a combination of all 5 different disciplines. And the focus is primarily on return to function. So the patients in this particular area of medicine, generally, as I've mentioned, are deconditioned, depressed, difficulty sleeping, difficulty working, if they are working at all, and a variety of other aspects. Each of those aspects would be identified in the treatment plan itself. And someone within the treatment team would take the lead on approaching that need by the patient. So, for instance, if somebody is significantly depressed, then that would be the focus of the psychologist to address those issues associated with the depression. And the fact that most of the depression would be related to the patient's continued discomfort and dysfunction would mean that the physical therapist and occupational therapist could also play a role in that treatment plan, but the lead would be by the psychologist. Another example would be if someone has a problem that they are, on too much opioids, and the goal is to get them on the least amount of opioids possible. Well, obviously, the lead in that is going to be the physician, and creating the most effective and successful detox program. But in that particular case, almost all of the treatment is going to be provided by the rest of the team, which may sound a little odd, but the physician is going to write the order for less and less medications over the time that the patient's in the program. He or she is also going to provide some of the education associated with the detox process and protocol. But as you can imagine, the patient is going to be concerned about increased discomfort as the medication is weaned down. So therefore, all of the other modalities have a role in being able to help the patient manage their pain more effectively. So there may be the things that the physical therapist can do from a modality standpoint. There may be relaxation exercises that the psychologist utilizes. There may be, sleep hygiene aspects that can be utilized by the nursing staff, or there may be posture or, different modalities that the occupational therapist can provide. And all of this done within a team approach to give the patient the ability to manage this detox process in a way that allows them to not only feel less discomfort or less withdrawal issues, but also actually reduce their discomfort as they're on less and less medications. So it's important for us to be able to see how the combination of treatments, modalities, and therapies works very well with the detox aspect of patient care. So there's a strong interactive process in the development of chronic pain, but the interdisciplinary pain management addresses that complexity with a very strong interactive clinical approach so that the patient receives the treatments needed to achieve their goals in a way that is very powerful. And again, as I mentioned, very time compressed. So it increases the intensity of the treatment and therefore increases the outcomes that we provide the patient in the program.
How long does it typically take to see results from interdisciplinary pain management?
That is one of the more exciting aspects of interdisciplinary pain management. Again, to set the stage, it's important to realize that the vast majority of patients that are referred for treatment in an interdisciplinary program have been in pain for an average of 2 years or more. They have taken an average of 9 medications. They have usually had 2 surgeries. They've had various injections. They've had, all kinds of physical therapy and massages and chiropractic care and all kinds of things. And they are no better, and often they are worse than what they were before referral to the program. I'm really proud to tell you that this is an extremely powerful treatment approach. And it's common for patients that are involved in this treatment to begin feeling results within a very short period of time. Now, it's important to realize that as they start, we often will increase their pain medications because they're going to be active. They're going to be doing things that are likely to increase their discomfort. But at the same time, we're going to help them manage a lot of the other comorbidities that are attendant with the chronic pain development over time. And so they may have, less pain than what they initially started with. But what's even more important is that they're going to feel better, and they're going to have that encouragement from themselves or from the team, as well as from the other patients that are in treatment. So what you see is that it's not uncommon within 2 to 3 weeks of treatment that the patient is beginning to feel much better. A patient that we had in our program recently started out, had been in pain and on opioids for 10 years, had been unable to work, had been unable to function for most of that time. And within 3 weeks, went from a very high dose of opioids to 0. And their pain level went from what was estimated to be a 9 out of 10 to 0 in 3 weeks. So it's a tremendously powerful treatment approach. And it's a key to see how the combination of treatments allows us to do things with patients that are not possible in the traditional medical approach. So it's the impact of the combination. It's the compression of the timeframes. It's the understanding of the various medical conditions that we treat. And as long as a patient is motivated and willing to work hard, they will get better. It's a very high level of pain relief. And the programs that I was fortunate enough to develop over the years, and at this point, I'm in the process of developing the 23rd. The average patient in the programs would have a 276% increase in physical functioning, a 45% reduction in chronic pain, an 85% reduction in opioid intake, and a 60% return to work. And those statistics are 1 year after treatment. So what's important to also see is that not only is interdisciplinary pain management very powerful, but it's very durable. And that's because the patient is given a lot of understanding and education about the various treatments they're doing or engaged in. And the goal is to make them in control of their pain, as I mentioned, and to give them the tools so that when they leave and they're back at home in their normal environment, you don't see any slippage or you don't see any resurgence of the chronic pain.
Is interdisciplinary pain management covered by insurance?
The short answer is yes, but the more specific answer is it depends on the type of insurance that you have. Fortunately, years ago, the insurance, all the payers, including Medicare, covered interdisciplinary pain management very effectively. But the way that interdisciplinary pain management is provided is in a day-long treatment approach and is generally provided over 3 to 4 weeks. So consequently, the insurance companies have to have what's called a per diem reimbursement rate. And back in the 80s and 90s, that was the case. And it was very much a treatment approach that all the payer sources were very much behind and very much invested in because it gets results. When patients get better, the payers don't have to pay as much. It's pretty common that the patients that participate in this treatment will see a dramatic reduction in their use of healthcare medications. Obviously, surgeries are much less common, and so it's very effective long term from the insurance company's standpoint. However, at this time, because of the hiatus between the late 1990s, early 2000s, and 2017, we're still in the process of explaining to the insurance companies, educating the insurance companies about interdisciplinary pain management. Even though it's been around a long time, it's not been commonly offered throughout the country. And so consequently, what you'll see is that if someone is referred to or is interested in participating in an interdisciplinary pain management treatment program, it will be important to talk to their insurance company specifically that they have. And the programs will all help with that discussion. And there are insurance companies already that are covering interdisciplinary pain management. Aetna is one, and at this time, Blue Cross Blue Shield is coming on board, and Medicare appears to be willing to pay for interdisciplinary pain management as well. They've just recently come out with Medicare policies for interdisciplinary pain management, and the other insurance companies are on the way. So the key answer to that is yes, insurance companies are willing to reimburse the providers that do treat patients with interdisciplinary pain management. But it's something that is still a process that has to be engaged in so that we can get the approval for the treatment. Now, one of the things also is that since the referral to a program is not a referral for treatment, it is a referral for assessment. So the initial, the initial ask of the insurance company is, will they be willing to pay for the assessment by the interdisciplinary team? And then once that assessment is completed, if there is the desire to treat this patient and for the patient to come in to the program, that gives the patient as well as the treatment team much greater information to be able to provide that to the insurance company and give them a chance to approve the admission to the treatment program.
How do lifestyle changes such as diet and exercise contribute to pain management?
Diet, exercise, and activities play a major role in interdisciplinary pain management and in pain treatment overall. It's important to realize that if someone is experiencing any kind of pain, especially chronic pain, that it does cause a reduction in activity, which then can set off this same spiral that I described, where the less you do, the more you have deconditioned muscles, the more your muscles become deconditioned, the less you're able to do. And unfortunately, that also can contribute to more discomfort. So there is a thing in the development of interdisciplinary pain management called the pain muscle tension cycle. And so an example is that if you said, well, what kind of response physically do humans have to pain? Well, an interesting one is that pain causes muscles to tighten up. If you've ever hit your thumb with a hammer, what you'll find is that your muscles will tighten up, your thumb will hurt. But it's interesting that for most of us, both hands will tighten up. Well, that reflex of muscle tightening in reaction to pain is an instinctive one to protect the body. And that's fine. Once the pain in your thumb goes away, your hand and muscles will relax and you'll kind of go on about your day and hopefully not hit your thumb anymore. But it is essential to realize that with chronic pain, the issue is that the pain causes the muscles in certain areas, usually in the area of wherever the discomfort is, to get tight. And if the pain is still there, the muscles stay tight. Well, unfortunately, those tight muscles, after a period of time, begin to hurt additionally. So the starting pain, the pain that began this process, is still there, but now the muscles that have been tight for some period of time also begin to hurt. But we just got done saying that pain causes a reflex of muscle tension. So therefore, that additional pain will cause other muscles to tighten up as well. And after a while, those muscles will begin tightening up or begin hurting, which causes additional muscle tightening, which causes additional pain. As you can see, this is a spiral that can easily get out of control. So one of the more important aspects of interdisciplinary pain management is to utilize treatments and modalities that can be effective in addressing this pain muscle tension cycle, which is extremely common in the development of chronic pain. So what we would look at is how do we incorporate those modalities into the lifestyle that a patient has. And along with that would be stretching exercises and other aerobic exercises to help the muscles receive the oxygenation they need so that they are able to relax and stay relaxed, even if there is some pain that is still chronic in nature. So again, what that concept is for the patient to learn to control the pain instead of the pain controlling the patient. And so diet is important as well. If someone has too much weight, if they're out of shape and they've gained a lot of weight because it hurts to move, it's essential that we help them have an appropriate weight. Why would that be? Well, because the studies that have been done on the pressure on someone's low back, for instance, is that a pound of weight in our stomach actually translates to 4 pounds of pressure on our low back. For someone with low back pain, especially if it's chronic low back pain, to have that spare tire in the front can create a tremendous strain on the muscles and ligaments in the low back. And so therefore helping someone reduce their weight and keep their weight at a healthy level is especially as important. In addition, there's common for patients with complex chronic pain to have other comorbidities. Two of the most common are diabetes and high blood pressure. And so the exercise and diet issue is going to play a major role in helping them address these conditions, which are also chronic in nature, unless someone becomes a lot healthier. So it's really important to be able to focus again on helping people return to function. And that means utilizing everything available, including diet and exercise, to be able to help them manage their pain.
What is the role of patient education in interdisciplinary pain management?
The role of education in interdisciplinary pain management is extremely strong. It's very, very powerful. One of the more important aspects of the training that we provide to clinicians in interdisciplinary pain management is to help them understand what pain is and the fact that we experience pain all the time, but that doesn't necessarily mean that we develop chronic pain. So, like I said, bumping your elbow, you're hungry, you've got, you have allergies and your sinuses hurt. Those are all examples of pain we experience, but those aren't necessarily chronic pain. So what's important is that all three of those examples I gave were things that we, for the most part, understand. If I'm hungry, I know what to do. If I bump my elbow, I know how that happened. If my sinuses are bothering me, I know what that is, and I know what to do to treat it. The key thing with the educational component with the chronic pain patients that we treat is that they don't know what this is. They don't understand why they hurt. They don't have, a medical degree to be able to, understand what is this problem and where did it come from and why do I still have this pain. In particular, what makes it more difficult is that a lot of clinicians don't have a full understanding of pain either. It's interesting that a lot of clinical disciplines get very few hours of training. There was a recent study done that indicated that for most physician's assistant in most training programs, they receive 5 hours of training in the treatment of pain. And when you realize that pain is the single most frequent reason that patients will see a clinician, it's a little bit disappointing that we don't get more training in how to be able to recognize and treat various types of pain. So one of the more crucial aspects of the treatment for complex chronic pain is to be able to answer the question, what does pain mean? And in particular, what does this patient's pain mean? And from that standpoint is that it means that they need this particular treatment approach or they need that modality in order to manage that discomfort and that pain. So it's really a huge part of the overall treatment process to be able to help patients essentially become their own clinician to some degree, that they're able to say, okay, when I feel this particular pain, that means that my hamstring's tight and I need to do careful stretches to be able to get it to relax, or that I've become tense in my trapezius muscles and that's causing me to experience a headache. And that therefore I need to do relaxation exercises, or I need to be able to put some ice on that particular area of my neck. It's important that it's the education component of the interdisciplinary treatment approach that gives the patient the tools they need to manage things on their own. Now, there's an example of something that is a very large part of almost every chronic pain patient's discomfort, is the fact that all of our senses, hearing, seeing, tasting, touching, have an adaptation response built into them. That means after a period of stimulation, that particular sense doesn't respond the same way. And two examples that most people understand is that if you are getting cleaned up and you put some cologne on, you generally can only smell it for about 2-3 minutes. It's not gone, but your sense of smell has adapted. And that now becomes the normal sense response. Another example is that for most people, if you are watching TV and someone falls asleep watching TV and you decide that you're going to turn the TV off in order for them to be able to sleep better and be able to be more relaxed, frequently what will happen is the patient will wake up because their sense of hearing has adapted to that level of noise. That's now the norm. Well, the sense that tells us what our muscles are doing is called proprioception. It's what tells us if our muscles are tense or relaxed. It's what tells us if our muscles are moving or not moving. It tells us where our muscles and limbs are in space. Well, it's a sense, just like any other. And just like any other sense, after a period of stimulation, that sense becomes adapted. So it's common for people, especially people with chronic pain, that have the response or reflex of muscle tension, that those tense muscles not only begin to hurt and get tighter and hurt more and get tighter and hurt more, but the patient will lose their sense of proprioception. So they will not necessarily feel all of that tension, but they will feel the pain. And they will feel increasing pain in reaction to the increasing tension. But because of the adaptation of their proprioceptive sense, they won't feel it. They won't know that their muscles are continuing to be tight. So this is an example of the kind of education that interdisciplinary pain management incorporates in order to help a patient not only manage the discomfort, but even more importantly, be able in the very beginning of the treatment, be able to say, oh, this is what that pain means. It's an answer to the question that often has been very, very difficult for the patient and very frustrating because there is not any real understanding of why do I continue to hurt, or even more important, why am I hurting more? So education is one of the most important parts of interdisciplinary pain management, and it is offered throughout the treatment day in various ways.
How can I find a qualified interdisciplinary pain management provider?
The most effective way to find a qualified provider of interdisciplinary pain management at this point is to look on the website for the Commission for Accreditation of Rehabilitation Facilities. I was fortunate a couple of years ago to be asked to revise the pain standards that the Commission has for interdisciplinary pain management, and we made them, frankly, very stringent. And the Commission assesses the pain centers in a way that allows them to ensure that the quality is there and is going to be there long term. An accredited program, if they are accredited at the top level, they receive that, but it only is for 4 years, and then they have to be reaccredited. So it's a very strong quality assurance process. So the good news is that as interdisciplinary pain management is being revitalized and is now being looked at from many organizations, it's important that we have the quality assurance process built into that revitalization from the very beginning. The problem we have at this point is that there are only about 5 inpatient IPM programs in the country and only about 40 outpatient. So it's still less than what is needed. As I mentioned earlier in this discussion, that there at one time was about 3,000 facilities. And so we have a lot of work to do to develop additional programs. To give you an idea as to how much growth needs to occur for us to be able to adequately address the patients with difficult pain in the country, the most conservative estimate in the literature is that 6% of any population within the country are suffering from complex chronic pain. So in the country, that's about 25 million people. So there's a very high need at this point for the continued development of interdisciplinary pain management. But in this development, we have been focused very heavily on trying to ensure that the quality would be there so that the outcomes would be consistent with what we've achieved in the past. So that's why I would reiterate for anybody that wants to, pursue treatment within an interdisciplinary pain management program, or for a clinician that wants to refer a patient to an interdisciplinary program, or for a payer source that is being asked to pay for the treatment of a patient with chronic pain. The initial place to look would be the Commission for Accreditation of Rehabilitation Facilities, because even though that program may not be close to where you are, it will allow you to be certain that the quality of treatment you receive will be at the highest level possible.